Welcome to Health Chats with Abington Health. I'm Luann Cahn. I'm the Director of Career Services for Temple University School of Media and Communications, and I'm thrilled to be your host for Philadelphia Magazine for tonight's web chat. The web chat is sponsored by Abington Health in partnership with Philadelphia Magazine, and our topic tonight is preventing health disease. Tonight's web chat, we hope, is going to help take you through the steps what you need to do all through your life, your 20s, your 30s, your 40s, 50s, and beyond, to keep your heart in really good shape. And tonight we're talking to Dr. Andrew Fireman, who is a cardiologist at Abington Health. Thank you to everyone who's already submitted questions for tonight's health chat. Before we begin, I want to remind you that during this chat you can continue to ask questions. All you have to do to submit your additional questions is go to that text box right below the video, and all the questions, by the way, are going to be kept confidential, so don't be shy about this. We also encourage you to invite your friends tonight to join us. Log on at any time during the chat. You can do this by sending the link to the Health Chats webpage via Facebook, email, or Twitter, and make sure to stay until the end because the topics will change based on the questions that are coming in. So, okay, Dr. Fireman, you ready?
All set.
All right. First, tell us a little bit about your background and your expertise.
Well, first I'd like to thank Philadelphia Magazine and Abington Health for having me on tonight's webcast. I'm a Philly guy, went to Jefferson Medical School and did my training at both Hahnemann and Medical College of Pennsylvania, and I've been in practice since about 1994. And I've been practicing general cardiology with special emphasis on echocardiography or cardiac ultrasound at Abington for the past 10 years.
I guess one question everyone wants to know are what are the basic symptoms of that you have a problem?
Well, in general, when we're talking about coronary artery disease and heart attacks, things of that nature, symptoms of exertional chest discomfort, easy fatigability, exertional heartburn, jaw discomfort, back discomfort. I get very concerned when I hear patients are becoming very sweaty and clammy when they're having symptoms. That really is an indicator to me that this is something that raises a lot of concern. So those are some of the symptoms that one would look for: shortness of breath, symptoms that don't go away, that are triggered by exercise but aren't necessarily relieved with rest, chest discomfort, back discomfort, jaw discomfort, teeth discomfort. These are all symptoms that get people's attention.
You know, I've heard a lot recently about the different symptoms that men and women have. Can you talk about that?
I think of, this comes up a lot of emphasis on women and heart disease, and women will, I personally think of a lot of the symptoms the same. I'm looking for sort of patterns and certain types of ways that patients describe symptoms, but I think for a woman who may be experiencing some cardiac or heart type symptoms, oftentimes there's a lot more of, they're not quite as typical as, you know, the elephant on my chest or the brick on my chest. There might be more of a shortness of breath, or maybe some shoulder discomfort, or maybe some neck discomfort, or maybe an indigestion type feeling. Men can have these symptoms as well, but there is more of an emphasis, I think, in women to be very on guard and on the lookout for these more subtle types of symptoms, not just this awful feeling on your chest where something, you know, seems to be very, very wrong.
You know, I feel like I know people, I'm sure everyone knows someone, they had a member of the family die at an early age and they feel like, oh my gosh, that's going to happen to me. Can you talk a little bit more about, yeah, what do you have them do? What are the specific things you have people do?
Well, first, you like to get an assessment of, as I said, we assess risk to see, I mean, family history is one element of risk. And just because that family member had an event at an early age, the script isn't 100% written for you. Clearly, it needs to be addressed and put into the equation. What we tend to do is, assuming the patient does appear to have elevated risk, we would get very intensive in starting to lower cholesterol, tends to be with statins. We may do some testing to look for what I've termed earlier subclinical disease in the vessels that isn't severe enough to cause a symptom such as chest discomfort or shortness of breath, what have you. Based on those results, we may then intensify our lipid reduction further. If someone's smoking, clearly they need to stop smoking. Patients need to begin proper diets, limiting their saturated fats, limiting their cholesterol, limiting processed foods, weight reduction. I mean, one of the interesting things that I tell my patients is I find that people are concerned about their heart risk, and they're sort of looking for the thing. How can I prevent this? How can I make sure this doesn't happen to me? At the end of the day, if you can keep your waistline, at least in a woman, less than 35, if you can eat a proper diet that limits red meat, saturated fats, and cholesterol, if you get regular exercise, probably in the neighborhood of about 150 minutes per week, maybe 30 minutes a day, 5 days a week, if you do not smoke and you maintain acceptable blood pressures or relatively low blood pressures, you can prevent about 80% of heart disease over a lifetime. There's a big push now for lifestyle changes. I was just reviewing last month's one of the journals. The cover was "Get a Life, quote, style," and it was really all about these interventions. There's no sort of magic bullet out there. There's no magic test, and there's no crystal ball. You just have to, it's mostly just a lot of common sense.
No, I mean, that sounds like a recipe for a really good, healthy life for anybody. Let's say you were really unhealthy early on, and then you realize the error of your ways. Can you reverse what you did in terms of heart disease?
The answer to that is yes. The answer is yes. I mean, if a patient goes on a very rigorous diet, a very rigorous program, a very rigorous program of cholesterol reduction, studies have shown that that the plaques can recede. They are very intensive diets, often vegetarian diets, and often using very high doses of the statin agents. It's not always practical. It's not always attainable. And one of ways that I look at heart disease, again, we can live a long time with blockages, but we can't live a long time having heart attacks and strokes. So people and patients get very involved with severities of blockage. Oh, I have an 80%, a 50%, a 90%, which is important. In my mind, it's important for the development of symptoms. But the real question is, how can I prevent the heart attack? Well, it turns out not all of these plaques are the same. Plaques are different. There are stable plaques and unstable plaques. There are sort of calcified, more mature plaques, and sort of very cholesterol-rich, soft plaques, which are more vulnerable to causing events. So I challenge the patients to sort of modify their lifestyle in the hope to take those more unstable, vulnerable plaques that cause events and sort of turn them into a more stable plaque that is less likely to cause the events.
All right, doctor, I have to ask about this because a lot of people seem to think that stress has something to do with heart disease. Does it?
Well, the question of stress and heart disease has been out there for decades. I mean, back in the 70s, there was the whole talk of the type A personality, increased sensitivity to time and anger and short temper and so forth, that this was a cause of heart disease. And this sort of thinking has sort of gone in and out of favor. And more recently, there's been some data published and review articles that have come out that are sort of looking more at the roles of stress, and not just sort of generic stress, but actually different types of stress. You know, is family stress? Is there work stress? Is there personal stress? Sometimes it can get a little bit deeper into emotional stresses and maybe levels of stress that might lead to depression. And all of these things do tend to increase your risk. The numbers that they increase your risk by are relatively small, but I think there is a role for that. I think of a lot of the stress as more being a trigger for events as opposed to an active player in the creation and the progression of plaques. That is a debatable subject. I think there's more research that's being done in that area. Clearly there's an association. How to intervene with stress is it's sort of a moving target. There are some recent studies that have actually shown that exercise can relieve stress and improve sort of heart health more than sort of antidepressants can.
Another question just came in. Where do you recommend looking for advice on proper diet and exercise health? You've given us some great ideas. Is there a good place to go?
Well, I think you could go on abingtonhealth.org, and there are dietary counselors there and dietary programs. I think for lots of patients that are looking to lose weight, I think the main thing is a program, something that educates and sort of arms the patients with knowledge, how to read a label, how to count calories, knowing what the proper caloric content is, not just sort of making a meal-to-meal-to-meal decision. I think those types of things are going to be very difficult. You really need a plan and almost wake up every morning knowing sort of what you want to eat. And if that's going to be a diet that, a fad diet, that you picked up and it sort of makes sense to you and it seems to work. And I'm not talking sort of the, I don't know, some of the more outlying fad diets, but if you want to go to you pick up a book and you saw the Sugar Busters diet or something, I think that and that makes sense to you and you can maintain it and you feel like you have some knowledge. I think that's a reasonable way to go. I think Weight Watchers is always very good. Some patients they're more successful with meal replacement. Dietary counselors, nutritionists, there's all kinds of different things, but I think the most important is a plan and advice and knowledge.
Dr. Fireman, Dr. Andrew Fireman with Abington Hospital, cardiologist, you've given us so much wonderful, great information. If you wanted to leave us with one last thought very quickly, what would it be?
Well, I've said it 3 times, but let's eat right, not smoke, get some exercise, and keep our waistlines in check. And I think the other one is, this is going to be sort of a shout out, and she'll know who she is, but early heart attack care. I think we talked on it before. If you think you're having a heart attack, don't delay. Seek medical attention. Call 911. Don't drive yourself. Get to the hospital. And let the providers do what they can do, from the emergency room to the nurses to the EMTs to the docs to everybody that's involved in that process. It's very coordinated and it could save your life.
Dr. Fireman, thank you so much. I want to remind everyone that our chat is on Tuesday. The next chat is on Tuesday, March 24th at 6 p.m. with Dr. Andrew Starr. He's the medical director of Abington Health's Orthopedic and Spine Institute, and he's going to answer your specific questions on knee pain, both conservative and surgical treatments for knee pain, and he'll be educating us on Machoplasty, a highly advanced and minimally invasive knee surgery to relieve pain caused by osteoarthritis. And you can sign up and ask your questions ahead of time by registering on www.abingtonhealth.org health chats. Thank you so much for joining us. We've enjoyed it, and thank you to Philadelphia Magazine for hosting. Have a great evening.